chronic health condition that affects millions of women worldwide. It often goes undiagnosed for years. Nearly 1 in 10 women suffer from this disease. Endometriosis is just dismissed as normal periods pain. There is no cure. Welcome to Second Opinion, where experts speak first. According to the World Health Organization, endometriosis impacts an estimated 190 million women of reproductive age globally. That's about 1 in 10 women. But why does it happen? The disease occurs when tissues similar to the lining of the uterus grows outside it. The common signs and symptoms include severe pelvic pain, heavy periods, pain during intercourse, fatigue, and in many cases, infertility. It significantly reduces quality of life and can make daily activities a real struggle. The bigger challenge is not getting a diagnosis. What is disturbing is that studies show women often wait between 7 to 9 years or sometimes longer from the onset of symptoms before receiving a diagnosis. Too often, severe pain is dismissed as normal period cramps, leading patients to see multiple doctors and endure years of unnecessary suffering before seeing a light. This delay not only prolongs pain but also drives up massive healthcare costs and lowers productivity.
Periods pain for a lot of people is considered normal. So because of which, a lot of people don't come to a doctor because when the period pain happens. So even with severe period pain, they keep still sitting at home. Nowadays, there is a little bit of awareness and they are coming when the mothers are bringing their daughters, saying that the periods pain is bad.
Commonly, they come to us with pelvic pain. Commonly, we see young girls coming to us with severe periods pain. We call it as triple dysmenorrhea. They have pain just before periods, during periods, and even after periods. So, commonest is pain. Second thing is, in reproductive age group, they come to us with severe pain and also infertility. So, what are the causes for endometriosis? There's genetic predisposition. It can be because of immune dysfunction. Endometriosis can be because of retrograde menstruation. That's the commonest thing that we come across. There are so many theories, but commonest is genetic predisposition and retrograde menstruation.
Sometimes it might never present with any symptoms at all. Sometimes it will be just like a normal couple trying for a pregnancy and they're not conceiving, and suddenly you find that, there is endometriosis.
And unfortunately, there's no cure. Current treatments like hormonal therapies to suppress estrogen, pain management, or surgery to remove lesions largely focus on symptom relief. While they can help, they often come with side effects such as mood changes, weight gain, weight loss, or bone density loss. Surgery may also need to be repeated because of recurrence, and access to specialized care isn't equal everywhere.
You can actually not diagnose endometriosis through an ultrasound most of the times, unless and until the patient has an ovarian cyst or an endometriotic cyst. So that is a main challenge. So, even if you send somebody for an ultrasound with severe periods pain, they might say everything is normal and still they will be struggling with endometriosis. Now, the only confirmation is when you put in a camera and you see the abdomen inside. Basically, it's called as a laparoscopy. So you can't do a laparoscopy for everybody because it is a surgery. It is done under anesthesia. So, for example, if it's a infertility couple and you're looking for causes for fertility, or if you're looking for a tubal blockage, you put in a camera is when you realize that she has endometriosis. So, and in young girls, you can never do a surgery immediately unless and until she has a huge ovarian cyst or something like that. Then you put in a camera and find out endometriosis. So that's where there's so much of delay. So the only time when it will go off from the body is when your periods stop. That is basically after menopause. So as long as your hormones are functioning, as long as your ovaries are going to be there, endometriosis is going to be there. So even if you treat, for example, you remove a chocolate cyst, or you treat yourself with you do a surgery and you release the adhesions, it's still going to come back. Now, the only treatment which you can do is symptomatic relief. That is, you can be on hormones. Most of the treatments are hormonal treatment, which will give you symptom relief. In case you are, planning for a pregnancy and all, then you can probably look for fertility treatments, something to improve the egg formation, because sometimes in endometriosis, your egg quality will not be good. You might not be ovulating at all. So in that case, you can give something to stimulate the ovaries. Now, again, there's a challenge because, if you're trying for a pregnancy, you cannot take these hormones. And you're already struggling with endometriosis, sometimes your symptoms are going to get worse during the process.
Experts also say that research funding for endometriosis lags far behind other chronic conditions with similar prevalence and impact like diabetes or hypertension. This acute underfunding slows progress on better diagnosis like non-invasive tests and innovative treatments. But there is some hope. What's the progress and challenges? Let's hear it from the experts.
Even cancer, you can remove the uterus or you can remove the ovary, there will be 98 to 99% cure. But in endometriosis, even if you remove the whole uterus, whole ovaries, everything, still there 1 millimeter of endometriotic tissue can again regrow anywhere. It can grow in your intestine, it can grow anywhere. So there is no 100% cure, but yes, there are newer modalities of treatments where we can give some hormonal tablets when it is diagnosed at a very younger age, very early stages. There are newer medicines, there are injections which can be given for a longer period of time so that your endometriosis is not cured, but at least we can maintain a remission. So the main treatment modality for endometriosis will be you should not get your periods. So when your periods have stopped, then your endometriosis will start shrinking. So for that there are many treatment options. Then there is a blood test called CA-125, which is not very specific for endometriosis. It is a tumor marker, but also can be used as a investigation modality for endometriosis. And then if it is very high, then as your treatment does, whether it is decreasing. And the last investigations is the MRI. MRI with contrast is the gold standard for diagnosing endometriosis for now, because you can identify ovarian cysts, you can identify if the uterus is having any adenomyosis, which is also part of endometriosis, or if there is any pelvic adhesions because of endometriosis, if the intestines are involved. But there is no one specific investigation and there are no hormonal tests to identify whether there is endometriosis or not. Hormones cannot help us to detect endometriosis.
Health experts are also emphasizing on more awareness, faster diagnosis, equitable care, and increased research investment to change the scenario for those living with endometriosis. Though there has been some progress, there is more to be done on the research front. If you are experiencing severe period pain or related symptoms, get talking to a specialist, since early intervention can make a difference. That's all for this episode of Second Opinion.